So I'd like to call the meeting of the Elder Care to order. Can we start by approving the, can I get a motion to approve the previous meeting minutes?
When was the last meeting for the minutes?
Open this up right here. It's in your minute.
15.
2015?
Yes, it was.
So that was 2 years ago. And council, seeing as this is a new committee, can we actually make a motion on something that we weren't here to be?
Yes.
Okay. So that 2015 will pass then.
Brendan, can I get
And that's good.
an agenda?
Oh, I'm sorry. Did you have that?
What did you say, Brandon, last time?
Before, I'm sorry. You know that, right? Because they all changed.
215.
Yes.
Yes, sir.
When's the last time this committee met?
20, August 26, 2015.
What the hell we got this committee? It hasn't met in 2 years?
That's correct.
Wow.
There's a rule
I thought it was
change.
going every month.
No, there's a rule change to get rid of the committee.
2 years.
So I guess we'll move it.
Motion to move. Can I get a second? Second. All right, so it's been motion and second. All those in favor?
Aye.
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 Aye. Opposed? All right then, so item 1. This is, we have this evening, Erin?
Yes.
Erin Strecklitz?
Stecklitz, yes.
Okay. Okay, item 1 on the agenda is, let's see here. Authorizing the acceptance of a grant funding and agreement with New York State Office for Aging regarding the Medicare Improvement for Patients and Providers Act grant to enhance the health insurance information, counseling, and assistance program.
Yes. So this particular grant application is something we've been obtaining for the last 10 years. It's an actual funding stream that we distribute some of the funding out to Senior Services Albany, which is one of our health insurance information, counseling, and assistance program subcontractors. And we do keep some internally, as our New York Connects program also provides health insurance information, counseling, and assistance, as well as the Department for Aging. We have one employee who does that. It provides an opportunity for individuals to have additional information about applying for the Medicare Savings Program, including the Qualified Medicare Beneficiary Program and the Low Income Subsidy Program, which subsidize people's prescriptions.
Any questions?
Yeah, one. Did you say just senior center in Albany?
Senior Services of Albany.
Is that the only service? It's just the ones in Albany?
No, it serves all of Albany County
Oh, okay.
residents, so,
The whole is involved in this thing?
yes.
Okay, thank you.
Anyone else? Okay, all right then. Can I get a motion to approve?
Motion.
Motion, second. All those in favor?
Aye.
Aye, thank you. Okay, item number 2. Amending resolution number 30 for 2017 with senior projects of Ravina for additional funding.
Yep, so we had the Senior Project of Ravina ended up producing or delivering additional home-delivered meals over and above what we expected this year, which was a good thing, which means we're reaching more individuals. We're asking for an additional $613.59 to supplement what we've already contracted with them for the year in order to make sure that we can continue to meet the needs of all the individuals receiving services in their particular home-delivered meal zone.
Questions? Gil?
Do you do that, do we all get the same amount of money, all the Meals on Wheel places?
They each, when we go out to bid for the home delivery meal providers, and they each come back with their own rate per meal, depending for hot and cold. So each year when we go out to bid, or every 3 years we go out to bid, they come back and they propose what their costs are for the meals. They each also apply for their own zoning area, so we have Senior Projects of Ravina, Peter Young Industries, and we also have Senior Services of Albany, who's one of our home delivery meal providers. And they all cover the Albany County area, depending on what zip code area they've taken on. So they
Who
each have their own
determines
rate.
who determines who delivers who makes the meals and stuff? Who determines that?
They each have an area that they cover. So when they propose their rates and when they propose their meal structure, they tell us which zones they want to cover, and then we score and rate the proposals, which we just did recently in June. So
Did we ever think about making this stuff at the jail or nursing home?
it has been investigated in the past, but I don't believe that it's something that is a cost-effective approach. It's certainly something, if the committee was interested in us looking at, we could certainly look at it again, if we're ready to go out to bid.
I would like to see, I'd like to see you look into that myself.
What was that, Gil?
About the jail or the nursing home looking into supplying the meals might be cost effective for us along them lines. It was mentioned years ago, but we never really got into the whole thing. But now this committee's gonna be an active committee, maybe we should look at it.
Yeah,
This is 75-25, 75 state, 25 county? Is that
I
correct?
think that's right,
That's
sir,
correct.
yes.
That's correct.
That is correct. Any other questions?
Make a motion?
Motion, can I get a second?
Second.
All those in favor?
Aye.
Number 3, amending resolution number 33 for 2017 with Peter Young Industries for additional funding.
Same scenario as the senior project in Urbana, we had an increase in the number of individuals who are looking to receive home delivered meals. So our contracted amount exceeded what we had anticipated, so we were looking for an additional $14,647.50 is the total amendment of rate that we're looking for.
Make a motion?
Motion. Can I get a second? All right, all those in favor?
Aye.
All right, unanimous. All right, number 4.
Just
Thank
quick
you,
question,
Aaron, thank you.
Madam
Yeah,
Chair.
Do you still have a question for Aaron?
No,
Oh, okay.
this is just in general amongst us. So we're amending 2 resolutions from 2017, number 30 and then number 33. But as I brought up, the last time this committee met it was 2015, so where did these original resolutions, what committee did they go through?
They came through social services.
And any reason why that they didn't go through social services this time around?
Well, they will be going through social services also, since this is the first meeting of the Elder Care Committee.
Yeah, but just reason why that, we didn't meet, and I know some things were just strange, we're amending resolutions that this committee didn't do back in 2017. Just curious, that's all. Thank you.
Good evening.
Good evening.
Number 4,
Hello, everyone.
how are you today?
Good, good.
Let me just read the resolution. Authorizing an agreement with Schenectady County Community College regarding certified nursing assistant training at the Albany County Nursing Home.
All right, this will be a program that will be totally operated by Schenectady County Community College and their instructors. It'll give them a place for the CNAs to be trained. They're really PCAs working into becoming CNAs. I think it's good for the community, it's good for the nursing home and the students. We're asking that this agreement be ongoing, as there's no dollars that are going to be exchanged. It can be canceled, this contract can be canceled with 30 days' notice after any term of the students. Traditionally, the program runs 120 hours.
Are there any questions? Yes.
Mr. Slacky, just a couple of quick questions. With this new partnership, is there a way for, I guess, not just for CNAs, but other nurses or skilled positions that have requirements that they can utilize Schenectady Community College for those requirements, or somebody that can work at the facility in hopes of getting these credits for a CNA that they can participate and then get their requirements or their education, or keep their certificates intact?
Yeah, well, we have other programs or just CNA programs?
Just, I didn't know if there was any other programs.
Oh, yeah,
so
currently
plead my
we are
ignorance.
used as a training site for licensed practical nurses, dietitians, MSWs. We have at least 5 different disciplines that are receiving through a contractual relationship, their consultation, you could call it, from our directors and their instructors on site at the nursing home.
So we would be able to hire, because I know that there's been numerous resolutions in the past to try to get some CNAs or RNs or different skilled positions that we can hire individuals, and would they be able to work for the county while they're getting trained, like as a...
Well, the answer is yes, and that's what we're trying to do with Schenectady County Community College.
That's wonderful.
We're hopefully eventually going to have a program where they'll start as PCAs while they're in school. After they graduate, they'll make a commitment to the nursing home to stay on for X period of months or years for that training, and then we'll convert them from PCAs to CNAs once they get certified. That's the goal. The more CNAs we have in training at our facility, we hope that they'll stay on and, work for us. Right now, we have approximately 22 full-time openings that I can't fill.
How many?
So 22. So we've been working on this now for months. And we also are working with BOCES, who is already on site and has been on site for years. And we're trying to encourage those people who are getting their training at the nursing home to stay on once they graduate.
And what does a PCA start off with that,
Salary?
Yeah, your
It's
hourly?
approximately, I don't have it in front of me, but I think it's $24,313, $312.
And then once a PCA, then there's a jump to a CNA?
No,
which is-
there is no PCA line in our budget. We only have CNA lines.
CNA lines, that's right.
So that the CNA line is 24,000 and change. There is no PCA lines.
So, I'm sorry.
No, I just said thank you, that's all.
Okay, and do we have any other questions? Okay, then I have one. So you said that the PCAs would become CNAs? If
Well, the
we-
question was put to me, could a PCA work at the nursing home while they're in school? And then after they receive their certification and are a CNA, can they then convert from a PCA to a CNA? And the answer to that question is yes, they could do all those things.
And so the
We
salary...
don't do that now.
We don't do that?
No.
But the salary for a CNA is comparable to the PCA?
It would be because our budget line only has one title and $1 amount. We don't have a PCA budget line. We only have CNA budget lines. But the program itself is so short that you're talking about 120 hours to make someone, to put someone in a PCA line for basically a month and then convert them to a CNA line is just a lot of work, which really doesn't benefit anyone. We could put a PCA in a CNA line, and then when they get their CNA, we just convert them, they're already in the line, so they're there already. We just now classify them on our records as a CNA. They're already in the right place.
Okay. Yes, Gil?
What's a PCA and NCA? What are you referring to? I don't know.
One's a personal care attendant, PCA, personal care attendant, and a CNA is certified nursing assistant. So one is trained.
Okay. That's what I mean, and nurses.
That's the difference. They're certified with this 120 hours. It's around 60 hours classroom, 60 hours hands-on. The hands-on they'll be getting at our nursing home.
Is that where there's a lack, you said there's 24 openings, is that where the openings are?
We have approximately 22 openings right now, and they're all in CNAs, certified nursing assistants.
Is that because the salary's low?
That's part of it. If you saw the Times Union around a week and a half ago, they did a comparison of salaries for registered nurses, licensed practical nurses, and certified nursing assistants in the Albany region, which included Schenectady, Troy, Albany. The average mean salary for certified nursing assistants is over $27,000. We pay $24,000. The average salary for registered nurses is approximately $65,000. We pay starting salary $51,000. So there's a huge difference in comparison. Now again, it's a mean of all healthcare facilities, so it kind of is skewed a little, to be fair, because we're looking at RNs who work in medical centers, which clearly make more money. But our salaries, when we increase them for the RN supervisors, if you remember, you were kind enough to allow us to do that for the RN supervisors, and we went from a salary of approximately $58,000 to a range of $66,000 to $71,000. We filled those positions within 4 months, and they've been filled ever since. So clearly, to get people in the door, having an appropriate salary is a start. One of the difficulties we have is, and this is coming through when I do my interviews, we, in our union contract, pay an evening and night differential, and most of my openings are on, a lot of openings are on evenings. We have around 10 openings on evenings for full-time people. We pay differential for evenings and nights. It's $750 prorated over all their hours of work for the whole year. It comes to around 40 cents an hour. The average in Albany region of the nursing homes is anywhere from 90 cents an hour to $1.50 an hour for differential. So if you can make, and plus if you have a base pay, ours is $24,000 and you're getting $750 differential, and now you could work in a nursing home in the Albany region where the base pay is, let's say, $26,000 and you're getting a differential of around 10% or another $1,000, $1,500. Now you're already up to around $16, $17 an hour, and we're under $15 an hour. They're not coming to work for us, and that's evident now.
What would you have to do to that type of thing increased? Why are the rates, the union negotiates them for you?
We have a contract that's in place, and that expires the end of this year, and I'm sure that will come up. To come back and to the legislature, prior to these negotiations and just arbitrarily find a number that we think is right, I just don't think is in anyone's best interest. I think we need to negotiate with the union to see, what the appropriate numbers are. We would have to meet with management and budget, look at all of where we are and what we think we need to go, and come with a number that we believe is real and that we could afford. We're still in troubled times at the nursing home until the renovation takes place and we open up our new building.
Well, I understand that. I understand.
We're still struggling, so I don't want to take money that we don't have and spend it. I'm trying to, balance it and present something that I believe is fair and equitable and that the nursing home could afford.
But if the union was coming at a lower rate and you guys thought it was lower, you guys would suggest a higher rate with the knowledge you do have?
Well, I think the union, our union that handles the CNAs is $11.99. They're in a lot of the nursing homes in Albany.
So they know the rates?
They know what the rates are. And one of the things that we have discussed, because we just preliminary started to negotiate, is the differential. I mean, we're paying $750 a year, and other places are at $2,000. It's a big difference.
Big difference. That's why we're short of help. But the
Right.
money, with a lot of money that we pay in salaries, without no oversight, we pay a lot of salary, a lot of individuals, high salaries, and, sometimes you forget about the workforce that serves the public every day.
Right.
So I'm a big advocate for more money for the workers.
I agree.
So look into it, Larry. Good.
I agree.
I noticed that you said we have 22 openings. Can you tell me how many CNAs we employ?
Right now, on staff, we have approximately 75 full-time CNAs, and then we have part-time and per diem.
Oh, so we have part-time
Yeah.
and per diem.
See, one of the arguments that have always been made, and this goes back years and years, county facilities, government facilities pay a salary with the understanding that they have these benefits of pension and health. And that's why salaries are where they are. And unfortunately today, that doesn't mean anything to the new worker coming in. You can't eat and pension and health. And to hire someone and say, well, in 20 years you could get health for life, or 20 years you could get your pension, it doesn't float today. People need a base salary where they can pay their bills.
Are there any other questions?
Make a motion?
I got a motion. Can I get a second? I got a motion and a second. All those in favor?
Aye.
Thank you. Thank you.
Okay, thank you very much.
Thank you, Larry.
Okay, can I have a motion to adjourn?
Motion.
Motion carried, second.